Hi, everyone. I feel like, okay, first, well, I'd like to welcome to the stage, of course, Dr. Marina Romanello, Executive Director of the Lancet Countdown on Health and Climate Change. I feel like this is a reunion because we were at COP28 last year, not on a stage, but in a cubicle talking about climate and health and fossil fuels. And so I'm really happy to have you here with us today. Um, okay, so at COP, we were discussing, and one of the things a powerful message really about you delivered was about the critical importance of phasing out fossil fuels. And I'm quoting you here, and you said fossil fuel phase out is the most effective and the most important public health intervention of our times. Could you elaborate on what fossil fuel phase out looks like in practice at the moment? And based on the findings of the Lancet Countdown reports, I know you've released regional reports recently. How is this phase out currently impacting global health outcomes?
So, on the basis that climate change is affecting the most fundamental pillars of health, climate change is affecting neglected tropical disease transmission, it's affecting the quality of the air that we breathe, the water, the food that we depend on. So, it's really undermining the very basic building blocks of health. And the oftentimes catastrophic impacts of climate change that we've seen up until today are happening at about 1.2 degrees of global mean temperature rise. Current policies and actions, things that we're actually doing to tackle climate change, put the world on track to 3 degrees of heating. We don't know quite well what 3 degrees look like because our models break at 3 degrees. Our epidemiological models, our human models, don't work under that level of climate uncertainty. But what we do know from what our models do tell us is that that future could be really disastrous. Could be, as I said yesterday and I repeat today, could be a death sentence for millions, if not billions. So tackling climate change and avoiding that sharp increase in temperatures is the most important public health intervention that we could do. It's a life-saving intervention. And the main source of that heating is the greenhouse gas emissions that are emitted by the burning of fossil fuels. So we know we need to tackle fossil fuels. We know that fossil fuels are incompatible with a livable future. And that's what the IPCC also told us. But on the flip side of that, there's also the other harms that the fossil fuel industry does to health. And we have estimates that say that annually we lose about 1.2, and there's a new study that says up to 5 million lives each year from outdoor air pollution that comes from the burning of fossil fuels alone. Add on to that the impacts of indoor air pollution from the burning of fossil fuels, and from the fact that a high dependence on fossil fuel has limited our capacity to transition to clean fuels. And what that looks like is that in many countries around the world, we're still highly dependent on burning not only fossil fuels, but also biomass. That many populations around the world are still heavily dependent on unreliable and unsustainable sources of energy. And that means that people not only suffer from the impacts of air pollution, but also all of the disadvantages to development and to health that come side by side with energy poverty. So transitioning away to fossil fuels and towards clean sources of energy and energy efficiency could mean that people have access to off-the-grid energy, clean source of energy, much more reliable energy in places that are most needed. And we're not seeing that transition yet. So you ask me, what does this look like today? It looks like very high Human Development Index countries produce about 11% of their energy from clean, renewable energy. But low Human Development Index countries are only at 2%. So those countries that are most burdened by energy poverty are not enjoying the benefits of the new technologies for energy generation.
You mentioned about the importance, of course, of transitioning out of fossil fuels, but there's this concept of just transition, right? Can you explain what a just transition entails and why it's so crucial from a public health perspective?
Absolutely. So this is what it looks like. It looks like we cannot leave behind half of the world as we transition towards a new world order. We know that we have international commitments. We know we need to tackle climate change. We need to do our very best to keep to that 1.5 target. That's the best chance of survival. And what that means is that we need to reorganize our whole economy. We need to reorganize the way in which we access the essential life and health supporting services. But in doing so, what we're also seeing is that it's the high-income countries that are leading the way. So the technologies are held in high-income countries. The advancement of that new economy is mostly in high-income countries, which means that we're leaving the so badly called global south behind. And we're again generating this divide in the way that we transition to a healthy future. What that looks like in an example is what I was just saying about access to energy, is the fact that the most vulnerable communities, the poorest communities, still depend on dirty fuels, are exposed to toxic air in their home where their families live. But it also means that in many countries, we're seeing still a high dependence on fossil fuels. And we've seen this particularly in much of the conversation about air quality, where the public-private partnerships are being made with the oil and gas sector, with the fossil fuel sector. And that means that the fossil fuel sector is looking at these emerging markets, is saying, well, how do I keep on selling gas to countries that are lagging behind in the transition? So we're locking in places like Africa, like South America, like South Asia, on a dependence on gas that is also harmful for health, that is not easily available, that is expensive. And that means that those countries will not be able to transition easily and will depend on global international companies on fossil fuels. And why that is important for health, we've seen it over the past kind of 2 years with the energy crisis. We've seen what the energy crisis did to people, what it means not to be able to afford energy because you're dependent on international fossil fuel markets that are highly volatile. We've seen what it means not to be able to afford the basic services for a healthy life. The flip side of that is also that we keep on investing in jobs that will not exist in the future. So how are we going to support the next generation in sustainable livelihoods, in accessing essential services, if we keep on undermining the transition to what the future will look like, particularly in the most vulnerable parts of the world? And while all of this sounds a lot about energy and economy, we have to understand that the economic and the social determinants of health are the most fundamental determinants of health, particularly in those countries in which those determinants are so frail.
What do you think can be done? Because we need to really work toward phasing out fossil fuels, but we can't leave the global south countries, especially some of the most vulnerable countries, behind.
So we need many things to happen in parallel. But I think the most important one is, as we have been hearing just now, is those partnerships and those cooperations between high-income countries, low-middle-income countries, and good international agreements for knowledge transfer, for technology transfer, and for grants, for funding that is granted, not loaned, to support low-middle-income countries for the just transition. There's very many financial mechanisms that were implemented in the context of the UNFCCC. There's very many financial mechanisms in the context of the WHO and other health frameworks. What we need to ensure is that those go hand in hand, that when we transition to a net zero carbon future, that we're transitioning also to a healthy future, that we're leveraging on those opportunities to ensure that, for example, we don't leave people without access to energy as we transition away from fossil fuels, that we fundamentally protect people's well-being, the development, and the fundamental determinants of their good health and lives.
Well, I do want to invite over on stage. We also have two more excellent panelists, of course. Shweta Narayan, International Climate and Health Campaigner with Healthcare Without Harm, and Omnia El Omrani, Climate and Health Policy Fellow at the Imperial College London and COP28 Health Envoy. I think they're having a reunion right now on stage because
Friends.
they're all at COP as well. I'm going to start with Shweta. We know, at COP, there was a celebration among the health community because it's the first ever health day during COP, right? And so, increasingly, health professionals see the importance of transitioning out of fossil fuels. However, what more do you think health professionals can and organizations can do to drive this transition? And why is it so vital that the health sector be at the forefront of this effort?
Thank you, Jenny. I'm a campaigner, and my basic job is to repeat. So I'm going to repeat a lot of what Dr. Marina has already said. But just thinking about health professionals and their fundamental duty is to protect people's lives. That's their moral, ethical, social duty. And when you're thinking about protecting people from the climate crisis, you cannot not talk about the root cause of the climate crisis, and that's fossil fuels. So it's not a luxury for the health community to talk about or a choice. It's just that their moral duty to talk about if they are really concerned about protecting their patients' lives. And I think the health community, which doctors, nurses, frontline responders, community health workers bear witness firsthand to the impact of on the health of their patients in their clinics, in their communities. So they are the most authoritative voice who are backed with evidence and should be talking in any platform about addressing the root cause, and that's fossil fuels. So that's what the health community did in the lead up to COP28, where they demanded from the world leaders a rapid, just, and equitable transition away from fossil fuels. And we heard what the whole concept of the just transition is, and why it's called just transition is because just is justice. So it's not just energy transition or jobs versus jobs. It's about health equity and climate justice at the core of this transition. And who better than your doctor and the nurses and the health workers to talk about what we are witnessing and what we need? So I think that's the reason why health community really needs to talk about the transition.
And it's not just about talking, right? Because according to Healthcare Without Harm, if the global healthcare sector were a country, it would be the fifth leading contributor of greenhouse gases, with 70% of that coming from the health supply chain. So clearly, the health sector needs to decarbonize. And of course, this has been a focus of your work. But what opportunities and challenges are you seeing toward that, decarbonizing the sector? And can you provide maybe one or two examples to illustrate?
Thank you for asking that question. And that is the interesting paradox that we live with, that the health sector, whose duty is to protect people's health, is also contributing to the cause of people's illness by contributing to the climate crisis. And this is an important recognition. And also, as I said, the moral and social authority of the health community is to talk about phasing out of fossil fuels. You have to lead with example. You cannot practice something else in your own sector and then preach something totally different. And I think the health community is increasingly understanding the seriousness of its own sectoral footprint and also the authority that it has about talking about a transition. And in the last couple of years, we have seen an amazing momentum in the health sector in recognizing that there is a necessity to transition to a low carbon, climate resilient healthcare. And the reason why I'm talking about low carbon and climate resilient, because there's a slight nuance. The high emitter and high income country need to rapidly decarbonize and move towards low carbon health infrastructure. While at the same time, the low and middle income countries and low emitter countries need to invest in resilient low carbon health development, so that again, the health equity and justice is at the core of health development across the globe. I also want to make a comment that it's important that health sector transitions, and we are seeing those movements, be it health sector signing up to Race to Zero, or many health institutions making those commitments and setting up high ambitions of net zero by 2030, 2040. But let's also remember that the health sector cannot adapt its way out of this crisis. And that's where the authority to influence other sector also comes. You can build the best low carbon, climate resilient health facilities around the world, but if other sectors continue to pollute and continue to depend on fossil fuels, the health burden will remain more or less the same, and the health sector will always be overwhelmed. So yes, you have to lead by example, but you also that gives you the authority to also transform other sectors.
Now, there's this call really to go low carbon, build resilient health systems. I want to go to Omnia because, how can medical schools better prepare future doctors to navigate this evolving landscape and its implications for patient care, and how much of that is happening today?
Yeah. First of all, thank you so much for having me back with my friends here on stage. And I think this is a very important question because when we talk about healthcare systems, we tend to talk about infrastructure, supply chain, but then a very critical building block in a healthcare system is the health workforce. And we are all, before we are doctors, we are students. And not just the medical education, but health curricula in general across all healthcare professions, whether nurses, doctors, public health professionals. It is so critical for climate change to be part of that. And I say this because as a medical student myself, not many years ago, I never learned about climate change in my own education, but I was very fortunate to be part of an international medical student organization across over 140 countries. And back then in 2020, during COVID, when we were all under stress and we realized that not only as our healthcare facilities and our education did not prepare us for a pandemic, but did not prepare us for another health crisis, which is the climate crisis. So decided to, when many of us had time off, to do a global survey across 112 countries. We had 2,817 medical institutions participate in this survey, and we asked a simple question: is climate change mentioned in the curriculum or not? And how is it mentioned? Is it a one-off lecture? Is it a course? Is it a mandatory course? Is it assessed? And we realized in our survey that was filled in by medical students that less than 15% of medical curricula worldwide had a mention of climate change. And this meant that over 85% of the future health workforce did not learn about climate change in their education. They were not prepared. And even if they were prepared, it was inconsistent. We did the same for air pollution. It was even less. It was less than 11%. But this helped us to mobilize as medical students, but we also had the support of medical faculties around the world. And we did a consensus statement that was adopted by many medical faculties, calling on the integration of climate change and planetary health at the core curriculum, looking into undergrad, but also postgrad. I'm very proud to say that over the last 4 years, I've seen how countries stepped up. The Netherlands has now integrated climate change across all the curriculum, across all the cities. In Egypt, in my own university, because of COP27 in Egypt, my dean decided to integrate climate change across all the faculties and not just the medical faculty, and to have climate change as part of that. And it is so important, not only because the health workforce is the one who is going to be the ones that will transition the healthcare facility towards being climate resilient and environment friendly. They are going to be the campaigners in the society and the trusted messengers, joining the global youth movement towards influencing countries not to backtrack on their promises, not to further invest in fossil fuel subsidies every single year, but also be the ones mobilizing that commitment and that accountability, because it is affecting us and our present and our future and the children and the adolescents that we represent and that we speak on behalf.
It's good to hear, that there's progress. You're seeing that, you mentioned in Netherlands, in Egypt, hopefully, in more countries, in more institutions. Right now we're at WHA. And of course, there's a climate and health resolution. Can you maybe talk about why is this resolution so important? Yeah. Marina, do you want to start?
So this resolution comes at quite a crucial point. It comes after COP28 last year, where we had the first Climate and Health Day. So with that, we introduced formally health within the climate negotiations, something that was long overdue. And now with this resolution and with the General Program of Work 14 as well, that acknowledges climate change as the first priority, we see climate change being incorporated formally into our global agenda for global health. One thing that has been really inspiring is over the 2.5 days that I've been here, we've been sitting with ministers of health. We've been hearing from leaders from different countries, low-income countries, high-income countries. And they've all been talking about how crucial action on climate change and health is for the health sector. That is something that did not happen before. And what is crucial is that this new resolution, alongside the General Program of Work, has now formally given that mandate to ministers of health, has told ministers of health worldwide, this is of your concern and it's your duty to take action. Because as Shweta said, this is the most fundamental determinant of health. This is a health issue, and therefore you need to be advocating for reducing that hazard, for doing what we call primary prevention, that is mitigating greenhouse gas emissions and reducing the hazards that we're facing. And now this is in everyone's agenda within their health ministries. So we're hoping that that will give us a lot more momentum for action from the health sector. One thing that is lacking, though, is first a mention of fossil fuel phase out, which, as Shweta says, is fundamental for health. So it's something that as health professionals we need to be advocating for. We know that it's very political. We know that there's a lot of pushback from big organizations and big lobbying, but we know that it's fundamental. But the other thing that we need is to ensure that this is not siloed in the health sector. The health sector alone does not have enough agency to act, but it has a lot of agency to influence other sectors. So what we need to see now is that it's not just about the ministers of health working with climate change, but actually that we're engaging in cross-disciplinary, cross-ministerial negotiations and agreements to drive this topic forward throughout the system that determines health and well-being.
You mentioned, of course, not just resolution, but that climate change is actually one of the objectives of WHO's new draft at this stage program of work. And it talks about having more climate resilient health systems and reducing the health system's carbon footprint. Maybe Omnia and Shweta, you can jump in and talk about how significant is this?
Yeah, I can go. I think it has been, as Marina said, so inspiring to see the mobilization of the health community in the climate space. But then the challenge was, how can we reciprocate that into bringing in climate into the health space? And the WHO resolution is a demonstration of that the health community now recognizes how climate change is affecting all aspects of determinants of health, all the progress that we have made when it comes to infectious diseases eradication, and also the importance of mental health in this conversation, which climate change is impacting. And we cannot talk about health without recognizing the health of the environment, which we depend on. And at the same time, the resolution means that it gives ministers of health the mandate, the confidence, and the comfortableness of working on this issue, because then many organizations, whether civil society, academic institutions, youth-led organizations, are going to work together to support ministries of health to lead the climate and health programming for their countries and the action that is needed, because it has been a big gap. It has been so inspiring to see at COP that over 50 ministers of health came to the climate conference for the first time in 28 years. And they came with commitments and plans that they want to integrate. So it's important to see that continue beyond December, and to see that now as we are in May, and to see that continuation. And another important thing, many of you have seen how many young people are frustrated by the lack of urgent climate action and justice that is needed, including action on fossil fuel. But what they're doing right now is that they are going to their countries, they are using litigation to hold their countries accountable for lack of climate action. A resolution like this is another accountability tool that young people and other civil society can use when their countries are not acting on climate change, because now it is affecting their health, their future, their basic access to healthcare services that is so necessary. And I think it also gives us the motivation and the push to work together with countries to finally implement the climate and health solutions that communities, the most marginalized communities, need.
Shweta, from the point of view of healthcare without harm, how important is this?
Again, I have to repeat this. This is huge. This is a big moment. This is, I think, the first step in breaking the siloed approach. So in climate negotiations, you'll not see the health ministries, but this really empowers. It's the first step in empowering the health ministries to participate and have a voice beyond the health systems, because climate crisis is a health crisis. So I think this really empowers health systems. This really empowers the World Health Organization. This is a huge opportunity. The only personal disappointment is the lack of mentioning of fossil fuels, because if we don't acknowledge that there is a problem, we will never find a solution. I think the first step in finding a solution is acknowledgement of a problem, and we are kind of like shying away because of all the politics involved in the fossil fuel conversation. I mean, I just want to leave everybody with a staggering piece of data. And the previous panel was talking about the need for funds. And, my heart was sinking as I was like listening to all the geopolitical development and the possible financial crisis in terms of like investing in health. Between 1970 and 2020, in the 50-year period, fossil fuel industries made a staggering pure profit of $3 billion US dollars every day between 1970 and 2020 for 50 years. That's the amount of money they're making at the cost of our health and our lives. If that money was invested in health development, the situation would be radically different. I think this is the first step. For us, this is the starting point. This is not the final destination. This gives us the opportunity to elevate the climate and health conversation in multiple.
Staggering number, of course. But we don't have much time, but I just very quickly, maybe, Dr. Romanello, what should the health community, look forward to at COP29?
Well, the COP29 will be a big COP on finance. So we will be having finance at the center of the conversation. Shweta mentioned the absolutely mind-boggling profit of the fossil fuel sector. There's also a huge investment being done by governments in terms of fossil fuel subsidies. There's a lot of money to go around. There's more than plenty. It's in the wrong places, and it's in the places that undermine people's health and people's well-being. So as we go to COP29, understanding how to divert those funds to supporting cleaner sources of energy, cleaner air, cleaner, healthier diets, healthier urban centers, and healthier future for everyone, that will be the priority. So we need the health professionals here to be talking about, as we just heard from the NTD conversation, about the finance that is needed, the grants that is needed, and in that sense, putting a lens of climate change. How is climate change exacerbating the funding needs, or how can that funding be redirected to increasing resilience as we deliver essential life-saving medical interventions to ensure that our healthcare delivery is resilient to a future of climate change, and to ensure that we have funding being allocated to those activities and those services that promote and improve people's health rather than harm it, as we're seeing with the billions, hundreds of billions that is every year going to fossil fuel subsidies.
Well, financing is always an exciting discussion, right? Thank you so much to our speakers.
Thank you.